patient presents today, a 35-year-old female, recently moved from Ohio, here to establish prenatal care. Patient says that she's 20 weeks pregnant, was confirmed by pregnancy tests when she missed her period 4 to 5 months ago. Also has had a ultrasound at 8 weeks, which was normal. Patient has been getting prenatal care since the first trimester, but is establishing care here. Patient complains of lower back pain related to the growing belly. It's relieved when patient rests. Currently not taking any medications except for over-the-counter prenatal vitamins. Patient does have a history of pregnancy on two other occasions, a miscarriage at 6 weeks and an abortion at 15 weeks. Patient was on Prozac because she was treated twice for depression in the past, not currently being treated now and not having any symptoms of depression. Patient's allergic to latex. She develops a rash when exposed. No other medical history or hospitalizations except for the DNC related to the miscarriage. Father died at age 60 from a heart attack. Mom has had diabetes for the last 10 years. Brother is healthy. No other significant family history. Socially likes to spend time with her husband and friends, enjoys reading, watching, football and things of that nature. Patient does not drink alcohol, stopped smoking when she found out that she was pregnant, had a 1 pack per day smoking habit, has a bachelor's in liberal arts, teaches, substitute teaches for 3rd and 4th graders. General patient weighs about 155 before pregnancy, now 167. No extra fatigue other than a little fatigue related to the pregnancy. No cardiovascular history, no chest pain, palpitations, or edema. Skin is clear and intact. No coughing, no respiratory problems, no unlabored breathing. No visual changes. Patient does not wear corrective lenses. GI-wise, patient did have some nausea and vomiting in the beginning of the pregnancy. That has since resolved, and she is not having any problems with that. Ears are clear, no problem, no hearing loss or changes, no urgency or frequency of urination, no burning. Patient has had a pap smear 3 years ago. She does not do self-breast exams. However, there's not been any lumps or bumps or anything found. Nose is clear and patent, musculoskeletal wise, just the back pain related to the growing belly. She's not had any increased thirst or hunger, and no history of blood transfusion. HIV status is negative, denies night sweats. Neurologically, she's intact. And the psychiatric history has been resolved at this point. Patient was 167. She was 155 before pregnancy. Temp is 97.1. Pulse is 75. Blood pressure is 132 over 64. Respirations are 20. She's about 5 feet tall. Let's see. So for the labs, patient's going to go for a pregnancy test. Patient had pregnancy test to confirm pregnancy. It's positive, BUN and creatinine. ABO testing to see blood typing for blood incompatibility. Gestational diabetes screen, TSH, because, of course, fetuses need that thyroid hormone in the beginning of pregnancy. HIV antigen to be confirmed, CBC with a diff to check for any anemia, and then another ultrasound to confirm gestational age at this point in the pregnancy. The assessments, the 3 different differential diagnoses were abdominal pregnancy, constipation, and then 2nd trimester pregnancy, which is 20 to 29 weeks, which will be confirmed by ultrasound. And we'll continue with the prenatal vitamins, add docusate sodium for the constipation, promotion of healthy diet, and green leafy vegetables and fibers that will help with bowel movement. Also encouraging exercise that's tolerable to just keep the bowels moving well. Labs and ultrasound is noted. Cultural educate patient on information regarding fetal development, diagnostic screening tools, importance of reporting findings to provider. Cultural considerations, consider that the patient had a not late term, but a 15-week abortion in the past, and just to evaluate how she's coping with this pregnancy, and that she's not having any difficulties with depression. And also depression screening should be completed. It's going to be referred to consult with the OBGYN and to follow up in 4 weeks or sooner if needed.